seeing right now. So, well, first, let me introduce myself a little bit, as we were asked to do. This is me. I did my PhD in these years. Oh, let me put it, OK. Around these years, it's a PhD in physics, so I'm a physicist. And I studied networks, epidemics, and collective behavior. And that's the title of my thesis, actually, networks, epidemics, and collective behavior, from physics to data science. Now, during this period, of course, I studied a lot of epidemics, and I got really tired. I didn't want to study epidemics anymore because I felt that what we were doing was completely disconnected from the real world. Like, the problem itself has a clear connection with the real world, but the way we were doing it was not connected to the real world. So I was very tired. I wanted to change the subject. And then I started my postdoc. I moved to Italy. And I started working at the ISA Foundation on a project that was kind of complexity data science applied to sustainable nutrition. So you see something completely different, more on the data science part of the spectrum. Now, I was working together with a company that you might have heard of. This company was called Ferrero, famous for Nutella, Ferrero Rocher, Kinder Sorpresa, Raffaello, Kinder Bueno, all these kind of things. So it was pretty cool. But yeah, as Marco just said, something happened. I don't know the exact details, but we ended up in a pandemic. My hair started to grow. I don't know. Many things were going on. So yeah, I did a lot of COVID stuff. It's what you do. If you have epidemiological training, around those days, you had to study COVID. But then again, in 2023, I moved back to Spain, and I'm a Ramon y Cajal researcher. It's the closest thing we have in Spain to a tenure-track position, so I can say I'm a tenure-track scientist. Also, it came with a nice amount of money for travel that I need to spend before the end of next year. That's partially why I'm here, because I accept any invitation from a country that has good food. Just throwing the idea there. So not invitation from the US, please. But anyway, so summary of the talk. I've created a summary because, as I said, I changed it several times. In the beginning, it was just about the paper that the title comes from, but now it's something weirder. I don't want you to get lost. So first, I will give you a bit of context. Spoiler alert, I'm just going to talk about data. I want to talk about how to use data in models and what we need to be aware of when we are building models and what do we do with the data. Now, after that brief context, I will go to the how we got here. And this is kind of like a completely biased historical overview of epidemiology, aligned into the problem of data. Well, you will see in a moment. Then I will talk a little bit about datamase that we found during COVID. And finally, I'll try to link all these ideas with an economic model super briefly. And that's the original title of these slides, actually. Well, anyway. So I don't think I need to enter into many details. Classical epidemic modeling, SIR, we all have heard a little bit about it. If we start adding compartments, because we need to take into account more concepts, we can do that, and we start adding letters. And then you go to literature, and you find things that are a bit, I don't know. I think this is too much, right? At some point, you have to stop labeling your model with the letters of all the compartments. It doesn't make sense. It's not useful for anyone to read this. The CPI keyword, no. You've created an epidemiological model for a specific problem, that's it. Sometimes I feel like from the theoretical point of view, we tend to just explore things because we can explore them, and we lose the focus of what we are doing and why we are doing this, right? And I want to tie that with this. I've censored all the information because I don't have anything against this guy, but I think it highlights a very real problem that we all face, I guess, during the pandemic. And it's that, well, I will just translate from Spanish, but I guess most of you can understand what it says. It says the Murcian, this is a region in Spain, mathematician that knows how many Spaniards will die because of COVID-19. So this was all over the news. He created a mathematical model that could predict the number of deaths in Spain. And you see it was all over the news, in many papers, so on and so forth. Now, for instance, here we can see that he said that the 8th of May, we will be below 50 deaths. Then in this other one that was published on the 15th of May, he says, oh, soon we will be below 100 deaths. Like, right? You see, this was after. We're talking about 100, before it was 50. I don't know. Doesn't make any sense. The problem here, it's not, let's say, well, yeah, the problem here is this. The problem here is this sentence. The problem here is that he said, if things do not change, everything will finish wherever. If things do not change, this was the situation back in those days. How can things not change? do we really understand what we are doing when we are modeling? So if we are just extrapolating a model, we need to be aware of the conditions of that model. We need to be aware if it's valid. Because, I mean, things are going to change. We could not be like this forever. So that doesn't make any sense. But even more, it was written in the law that things were going to change. This was the unlocking plan of Spain. So it was written that in early May, things were going to change. So you cannot create a model. You cannot go to the TV and say, hey, if things do not change, everything's going to end by this day. That's not good science. Doesn't make any sense to do something like that. Right? So that's the key idea I want to give to you, that you need to be aware of the surrounding conditions, of the data, of the models, beyond the specific thing that you are doing. But yeah, economists call this ceteris paribus. It's the idea of, yes, if nothing changes, we can do it. No, doesn't make any sense. Economists really like it, but no. We cannot do that if we are doing actionable response to a pandemic or any other problem, right? I'm also from a theoretical physics department. We tend to just focus on the theory, but if we're going to then talk to people, if we're going to provide answers to questions, we need to be aware that these things do not work in reality, okay? I really like this picture, that it's a joke against economists. Here is the economist saying, oh, ceteris paribus, while here is saying, hey, if you touch here, you see the cup of this guy will move because everything is connected. We are in a complex system, and we cannot just simply say ceteris paribus when we are modeling, okay? So this is the key idea of the presentation. If you understand it, that's it. Now, let's go with how we got here. This brief kind of historical overview of epidemiology, which I think has some nice ideas. So let's start roughly at the beginning. Again, this is completely biased. Miasma theory. What is this? The idea is back in those days, 19th century, people didn't know about germs. They didn't have microscopes. So they thought, for instance, that disease is just transmitted because there was like putrid air or bad air that came out of rotten matter, and that was what infecting people. They thought that cholera was actually that. Well, here we have a picture of Black Death. That's why they protected their noses, or that's what people say. I don't know, everything is unclear. But anyway, it was this idea that it was just the air that was infecting individuals. Then we go to the story of cholera in London. There were several outbreaks of cholera in London in the mid-19th century. And there was this initial idea that, well, at least there was a correlation between the altitude where people lived and the deaths of cholera. So the higher you were with respect to the river, the less likely you will die. So there was this idea that somehow just the air of the Thames River, where there was a lot of organic matter, was worse and would kill people. And then if you go up, the air will be purified and you won't have those problems. And then it came into play. John Snow, maybe you've heard of him. It's always mentioned when you study epidemiology as one of the first or the first epidemiologists. It's also mentioned in data science courses as one of the first data scientists. Nowadays, I've seen that his figure is controversial. Some people say that he had first the idea and then tried to make the data fit the idea. I don't know. I don't want to enter into that mess. Just to point out that what he just, in one of these outbreaks, collected all the data, painted it on a map, and got something like this. He saw that there were many cases around this pump. And this supported his idea that it was not the air that was transmitting the disease, we're talking about cholera, it was the water that was transmitting it. Again, people didn't know about germs, so it was weird, right? If water is completely clear, why should I get infected if I'm drinking water? In the end, he was right, and it was proven. It's a long story, but it was proven that, indeed, there were germs in the water, and that's what caused cholera. What's the main idea here that I want you to get in your heads? The first one is, of course, correlation does not imply causation. So we saw that, yes, there was something related with the height and of the altitude. And now that we know that it was because of the water, it kind of makes sense. If you were closer to the river that was completely polluted in the 19th century, of course, it was more likely to get cholera than if you were away. But it was not because of the altitude. It was because you were closer to the contaminated water. The other thing is that infectious diseases is spread by germs or pathogens or call it whatever. The point here is that we are going to need someone to transmit the disease to someone else, even if it's a vector-borne disease. So we need, this is super important when we are modeling, and sometimes I think it's neglected, and you will see why later. And the other thing that I think is very important, and it was also reflected in Marco's presentation, is that people were not completely wrong. So when we are doing a basic model, I mean, it kind of works, right? If it didn't, then wouldn't exist. We would have already changed the whole thing. So we need to be aware that whatever we do, we are trying to improve in a certain aspect. And there's going to be a certain resistance to accept that change because things kind of work, right? Well, anyway, let's go further a little bit, and we start with mathematical epidemiology. There is in the late 19th century, early 20th century, there was this discussion about why does an epidemic stop? Why do I mean with an epidemic that stops? This is a typical figure that is represented a lot. Mathematicians, epidemiologists really like to study measles because they have these weird patterns, right? There is this periodicity that is super cool. And they wanted to understand what's going on. And the question was, why, if we have an outbreak, it stops, right? Okay, then there is another question that why do we have another one later? But the first one was, why, if we start an outbreak, it suddenly stops? And there were two ideas out there. The first one was that everyone just gets the disease, that's why it stops. Or the other one was that the organism loses virulence in some way. So it's less infection, so that's why it disappears. Well, it was Hammer who proved in the early 20th century that you did not need any of those hypotheses. It was actually with just a mechanical theory of numbers and density, you could prove that the idea, I think he says, it's an absurdity. Yeah, an absurdity. So these ideas were an absurdity, that an epidemic simply may come to an end despite the existence of large numbers of susceptible individuals with, yes, this mechanical theory of numbers and density, right? So he proved mathematically that you don't need any of those two hypotheses. I highlight this because I was asked this in the radio in June 2020. So we are talking about 100 years after this, and someone asked me, hey, do you think that COVID has stopped because everyone got the disease or because now it's less virulent? And I was like, no, it's because we were in lockdown, right? So again, these ideas, we need to educate the people, let's say, with all of these ideas. So yeah, skip that. Now, we go a little bit forward, and we introduce the first epidemic models that we know today. McKendrick is one of the fathers of the SIR model. He was a doctor that was in the UK, and he was a military doctor and was sent to India with the military. And we know that he took with him this book, Higher Mathematics for Students of Chemistry and Physics, that if you open it, you will see equations like this one, that for some of you may be super familiar because it's essentially the SIR model. So we see that he took equations from chemistry and put it into modeling epidemics. Now, the important thing about this equation is not the equation itself, but what's behind this equation. What are the assumptions that there are behind this equation? And I'm going to just highlight, I think, the main ones. The first one is that the disease is directly transmitted from host to host. The second one is that the disease ends in either complete immunity or death. Of course, if we change the model, if it's not an SIR, this will change. Another one is that contacts are according to the law of mass action. This is super important. So here we're assuming that we have two chemical products that are interacting with each other. We are assuming that everyone, in some sense, is in the same place and that they can interact with everyone else. So whenever we are using this model, implicitly we are assuming this. Is that correct or not? It could be enough for the answer that we want to provide, but many times it won't be. So we really need to be aware of the limitations of our models before we apply them. Another important aspect was that individuals were only distinguishable by their health status. This has changed, as Marco said before. Age, for instance, is something super important. I will talk later a little bit about that. The other thing was that the population is supposed to be closed. If you're applying this for a certain region, is that region closed? No, right? So you need to be aware, again, of those kind of details before applying the models. And the last one that he highlighted in the paper is that you're assuming that the population is large enough to be described with a deterministic approach. So if we're talking about a small town, if we're talking about a small city, does it make sense? It may or may not. If we're talking about the schools, as we just saw, it doesn't, right? So for a school, we need to have the discrete character of the school taken into account. So again, what I want for you to get here is that we need to be aware, we need to list all these problems in our models or all these limitations before we use them. Now, yeah, with all these ideas, we build this model that essentially gives something like this. The only important thing is that, indeed, if this is a typical outbreak where we have many susceptible individuals in the beginning, now recovered or infected individuals, then we have an outbreak, and we end up with these recovered individuals and these susceptible individuals. The important thing is that the susceptible individuals is not zero, right? So it indeed stopped before reaching zero. And this is just because an infected individual needs to find a susceptible individual, and that's not that easy when we run out of them. Anyway, Another important aspect that you get with these models is the typical figure, the typical kind of phase transition in which if you are below a certain threshold, then the disease cannot grow. If you are above, it can grow. Well, it's not that interesting right now. Then we move a little bit forward and we go into what I've called a matter of size. So again, people were studying this, and now what they were trying to understand is why in some towns in the UK you can have an outbreak while in some towns that are similar you don't. Some years you don't have an outbreak. It was weird, right? Because, I mean, if it's because new babies are born and the same number, roughly, of babies are born everywhere, why don't you have the same outbreak everywhere? And, well, they use a stochastic and spatial model to understand it. It was just a very basic model. We're talking about the 1956 or something like that. And they showed that if you take into account the discreteness of the system, the stochasticity of the system also, in small town, it may be that you just get one infected individual. If that infected individual doesn't infect anyone, then that year, that town, it's not going to have an outbreak. Right? So sometimes it's going to be important to take into account the stochasticity, and sometimes it's going to take the spatial component of the models, the discreteness of the models. So we need to be aware, again, of the questions that we are asking, which answers are we looking for, and then with that, we can propose a model or another. I also like to highlight this quote by the paper where they propose this, when they say that, oh, one of the signs of the times is the use of an electronic computer to handle Monte Carlo experiments. Provided that they are not made as an excuse for avoiding difficult mathematics, it's okay, right? So people were a bit skeptical about these electronic computers when things started in the 50s, because they seem to be just something to get rid of the mathematics. I don't know if this will happen now with the artificial intelligence. Well, we will see. Anyway, so let me give you an example of the importance of this stochasticity. This is a paper that we published many years ago that essentially captures the same ideas that were already there in the 50s, but in a slightly different context. So here we were studying an SIRS model. So after recovering, you stay recovered for a while, but then you become susceptible again. If you model this with a continuous model, you get this kind of evolution. So there is a large outbreak, and after a while you have another and another and another, but the oscillations tend to dump, and then you get this stable value. Now, what's the problem? We tried to simulate this in a discrete system, and we got this, right? So we have one outbreak, and that's it. What's going on? Well, that's the problem, that we are using a continuous model that goes below 1, but we did not stop it, because we were just solving the continuous equation, and we didn't realize that. It goes below 1, then it goes, again, above 1, and you reach a stable value that it's above 1. Right? So technically, this solution should exist. But if we use a discrete model, this does not exist. So there are limitations when we are using discrete models or continuous models. Again, we need to be aware of those limitations before applying them. Now, one may wonder, what happens if, OK, I have a discrete model, everything stops here, like here, but then around this time, I'm able somehow to introduce a new infected individual. Well, then it is expected that just that individual should be able to produce all this whole thing again and get an endemic value of this disease in the population. And we can do that if we simulate a metapopulation. A metapopulation is just a collection of populations that exchange individuals, and indeed you get results like that. So we have this large outbreak, and under certain circumstances, if you get these dots here are importations, if you get a new case around this period, then you may have this outbreak that will last forever. So again, the importance of when to use a discrete model or when it's not needed. It's something that needs to be taken into account. Now, we move to the rise of viruses. This is a period between the 70s and the 90s that epidemiology was focused mostly on studying viruses. The reason was that during the 70s, gonorrhea started to increase a lot. And the important thing here is that they realized that this homogeneous mixing approach did not make any sense because sexual activities are highly heterogeneous. Right? So up to that point, for many diseases, it was OK. But in this case, they said, OK, we need to start adding heterogeneity in our models. And they did that with complex models. There is no need to enter into details. But essentially, here they call this the core, non-core model. They had two populations interacting with each other, one that had 10 times more sexual interactions than the other one. Right? So we have heterogeneity here. This is where this idea of a small fraction of the population creating most of the infections start to emerge, and so on. So we see that in the 70s, heterogeneity was already becoming a thing. Then we move a little bit forward to the 80s and HIV. appears. They start, now it's much more problematic because it's just not sexual activity level. You need to take into account gender, sexual relationships, drug use, so on and so forth. So they start to add more and more heterogeneity into the models. And they summarize essentially what they didn't understand about HIV. And it was that there was a virtual absence of a threshold in the density of hosts for disease agent persistence. That if you've ever studied network epidemiology should already ring a bell. But we will see that in a moment. They came up with this expression saying that R0, that essentially, if R0 is larger than 1, you can have an outbreak. If it's smaller than 1, you don't have an outbreak. They said that R0 depended on the average number of sexual contacts over the average number of the, to the square, right? Again, if you've ever studied epidemiology, network epidemiology, this should ring a bell. And this expression is from 1986, right? You will understand what I mean in a moment. So now, let me just add here briefly the demographics perspective, what I call. So in the 20s, demographers came up with this expression that it's a Taylor expansion of a certain theorem. If you get order 0, you get R0. I think this is where the name R0 comes from. I'm not completely sure. I've seen some sources saying things or another. But anyway, the important thing here is that this expression from the demography that is meant to study how the population is going to grow depends on two things. The first one is the number of women that there is in a population and the number of children that they have. That's it. Men are not considered at all because it's roughly negligible for the problem that we have at hand. The key point is that if you try to extrapolate this concept to epidemiology, you have a problem because it's not enough to have an infected individual that can infect many people. You need to have people to infect. And I feel like the R0 is illy defined. There are many problems with this formulation. We actually have now a master's student studying this. If someone is interested in these problems, please talk to me because it's a huge mess. Yeah, I will skip that. Well, except this part. This is the value of R0 for measles, I think it is, that was collected from many papers. You can see that it goes from 1 to 50. There are values in 20, 30. What's the problem here? Are they wrong? Does it make sense? No, the problem I think is that R0 somehow has to encapsulate human behavior, human societies. And if you neglect that, then you're trying to average things that are different. You cannot average things that were measured in different contexts, in different societies, in different times, because we as people change, even if the pathogen is the same. But anyway, so let's enter into networks finally. I haven't talked about this with Alessandro. I should, because just by reading his paper and reading the history of epidemiology, I came up with this kind of trilogy that explains how we get to network epidemiology. Let me start. So we already saw the first branch of this trilogy that is related to venereal diseases. The thing is that after the 70s and 80s, all this activity in trying to understand the spreading of viruses, Claude Hall came in the 1985 had the first idea, but the first real one was in 1994, where he proposed to study the network of contacts when we are trying to understand how an epidemic is spreading. And he proposed the following. He measured this network and said, okay, let's imagine that we have this situation in which we have an individual that is HIV positive and has 3 contacts. Epidemiology in the 90s would just ask, did you have sexual relationships with 1, 2, or 3? And if you say, with 1, then the doctors will just go and ask questions to number 1. But what happens if number 3 has many contacts? Well, that there is a risk there, right? Indeed, maybe you did not infect 3 yet, but if your relationship for some reason changes, the consequences can be catastrophic. So from a network perspective, they argued, you should try to take into account also the number of connections of your neighbors, right? So we are already starting to see networks coming into play in the mid-90s. Now, another branch of the trilogy comes from cybersecurity and computer networks. So the first computer virus appeared in the early 80s. Murray in 1998 said that, well, that was not a problem because in the internet, most individuals are acceptable, polite, orderly, and well-behaved, so viruses are never going to be a problem on computers. And then in 1991, Kephart and White said, hey, I want to study those viruses using epidemiological models, but epidemiological models consider that everyone's in contact with everyone else, and computers are clearly not like that. Computers are connected through networks. So let's try to simulate the spreading with some networks. And they got some results that they did not understand. They saw that many viruses survive for a really long time, and they saw that some of them reach only a small fraction of the population. They didn't know the math, they weren't aware of the things that the epidemiologists had studied in the 80s, so they were not able to make the connection of these ideas with the rest. And finally, the third part of the trilogy is the topology of the internet. Barabasi measured in the mid-90s or late 90s the structure on the internet, and they found that it was a power law. As you know, power laws have this property that the second momentum diverges, right, with the size of the system, of course. Now, if you combine all these three ideas, you come into the paper by Pastor Torres and Vespignani, in which they study epidemics on networks that became a huge hit. Essentially, they studied an SIS model of a network, and they found that R0 behaves like this. So this is the average degree of your network over the second moment. Again, this expression is exactly the same one that we saw that was already found in 1986. We're talking about roughly 15 years before this, right? So why did it change things in this point, and did it not change anything in 1986? I would argue it's because of data. It's because you can understand the consequences of this when you realize that the internet has a power law distribution, and thus this diverges, and thus this is zero, and thus there is no threshold, right? This is what changed things. It's not the expression was already there. It's the data that comes with the expression that makes it truly important. In fact, 2 months after the publication of this paper, other researchers measured a sexual contact network. They found that it was also power law, and so on and so forth. So we know that power laws are important in neuroscience, blah, blah. Now, again, the important thing here is that now that we have the data, the model could explain all the things that we did not understand about HIV. It could explain everything that we didn't know about computer viruses, explain the core group, and again, importantly, it gauges the importance of networks and data. It doesn't matter if you do the perfect theoretical calculation if you don't have the data to really understand what's going on. Now, after that, sorry? Beta R0. Yeah, this roughly R0. This is, I think, a homogeneous mixing scenario. So whenever the probability of infection is larger than the probability of recovering, then you can have an outbreak, unless you have an Erdos ranging network or random graph, that then it depends on the degree. It's a finite system, that's why you have this noise here. And then if you go to a scale-free graph, it goes to 0. Yeah, it's not the major point. Again, what I want you to get here, the idea is that you need data to truly understand the importance of this expression. Anyway, after this, we move into what I call heterogeneity 2.0. This is what epidemiology has been all about in the last decade. It's about trying to add more heterogeneity into the models, but you need to do it properly. So, for instance, one of the ways to do it is to incorporate age into the epidemic models, as Marco just said. Actually, these models incorporating the age of individuals, were already established 100 years ago. In the 1920s, there were already models like this. But the first time that we got data to truly calibrate these models was in 2008. So we had to wait almost a century to be able to take the theoretical model and actually apply it to real data. And what data I'm talking about? I'm talking about these kind of matrices that incorporate the number of contacts between individuals of different age groups, right? So if you want to read this matrix, this is an age group, this is another age group, and this is the number of contacts between them. So you see there is a strong diagonal here because people tend to interact with people of the same age group. And then you also have typically these 2 blobs here that are interaction between children and parents. Now again, the first large-scale surveys about this information were carried out in the early 21st century already. And the information that we have, the real data that we have for this matrix is very limited. We only have it for a bunch of countries. In many countries, it's very old. So this is from 2008, so it was collected in 2005. It's been already 20 years. Demography has changed. So is the matrix the same nowadays? Can we still use it? I don't think. I think this is something that is worth studying. Then again, many countries do not have this information. For instance, Spain doesn't. So that's also a problem, especially in Latin America. There are only very few countries, if or maybe just one or two that have this kind of information. So how can you calibrate models if you don't even have the data that you need? But there is another approach, actually proposed Marco and other collaborators, that is trying to infer these matrices from other kinds of public data, like taking the demography of the population, taking the occupancy levels, taking information about how large households are in a certain country, and trying to infer these matrices. But of course, this is always going to be inference. It would be better if we can actually do a survey and get the data. Now, lastly, this would be the end of the talk. We can also try to add more complexity into the models and try to incorporate other types of modeling, like economic modules and so on, but I will talk that later. The key point here is that nowadays we can run micro-simulation models that can keep track of billions of individuals and test public health policies. Again, depending on public health policy, as Marco Valenti explained before, you will need one of these models or not, right? That's a decision that you need to take whenever you are facing a new problem. And you need to be aware of the limitations of the model that you are choosing. I've seen many papers where people are using models that clearly are not made for that. But anyway, we can incorporate a lot of things. We can incorporate spatial structures, individual heterogeneity, multiple scales. This has reopened many theoretical questions, but we need data. These models need a lot of data. And it's a problem because there are money issues, ethical issues, time issues, there are issues everywhere, but we cannot expect to be able to use this kind of micro models if we don't have enough data. Now, we need more data about the socioeconomic characteristics of the population, we need data about human behavior, we need data, there are ethical questions about collecting this data and using this data, of course. And some of the theoretical challenges that emerge, there are also interdisciplinary challenges, there are many challenges when we try to use this data and try to use these models. And I think that one of the major problems yet to solve in the next decades is how do we incorporate human behavior here. And I'm talking about human behavior in a very wide thing. Just to give you an example that I like, this is Google Trends in the early COVID pandemic in Spain. This is what people were looking for in Google. So the first thing was toilet paper. There was this weird thing with toilet paper early. Then the state of alarm is we enter into lockdown. Then people were just looking for Skype and yoga. And then we have the pandemia in Spanish. I'm aware that in Portugal it was the paudemia. I don't know if here you have a paudemia. I know in Italy there was also pandemia in some sense. So everyone started to bake bread at home for some weird reason. This is human behavior. This is something that is spread throughout the globe. I don't know why. We need to understand these kind of things if we want to, I don't know, properly educate people about the use of vaccines. So again, incorporating human behavior in a broad sense into this model is something that it's a challenge for the future. And at some point, I would like to study what happened with this yeast and that thing all over the world, but that's a problem for another day. Now, let's go into the data mess. Just a couple of examples to break this monotony of the historical overview about all the problems that we have when we are trying to use public data and incorporate that into our models. Again, so the example that I gave you before, this idea that you need to take into account the discreteness of the system, see if people are going to another town, you need data on how people move, how many people go from one town to another. There was this study that the Spanish government tried to do in 2019, where they were going to track for 8 days all the phones in Spain. And it was not 8 consecutive days. It was like right before summer vacation, right after summer vacation, right before Christmas, something like that. The National Institute just wanted to know how Spaniards move in the country. Well, we have these things on the TV that essentially tell you how to prevent this, right? So like, how can you turn off your phone so that the government cannot track you and they cannot collect this data? So I can partially understand the issue, but again, we need this data if we want to understand how people move. And again, also, this was 2019. You know what happened in 2020, right? And we wanted to know if we need to close down the country. We needed to know how people were going to move. Fortunately, for some reason, before this news was released, the National Institute already had made a pilot project, and they had already collected preliminary data. And we were able to know how people moved around Spain. We did a paper about that. We did some projections. That's not the important thing. I think the important thing in this paper is that these are all Spanish regions, and here we have 2 outliers. Is it that the model that we did was wrong? Is it that the transportation data was wrong? Or is it that the COVID data was wrong? And the answer is the latter, right? So if you have a model that perfectly fits the data that you get from a public source, beware. There is something wrong probably, because the data is always wrong. In this particular case, our model predicted that the disease should have arrived very soon to this region. This region, and in particular to this small province. This small province is next to Madrid. Madrid is there in the city, in the center, right? And there is people that live here and commute every day to work in Madrid. Now, this is the number of infected individuals in all the provinces in that region over there. This one that is highlighted should be this one. That, as you can see, they start to have cases around the 17. They have maybe 10 cases or something like that, 19, 20. So they started to have truly cases around the 20-something of March. According to our model, this would be before. This is the number of cases that were in Madrid. In Madrid, by the lockdown that was already around here, things start to go down. So the peak was before the 20th of March. So how can it be that in Madrid, there was already a peak in the 20th of March, but there were no cases in this province before the 20th? Well, fortunately, we got the data about the number of tests that were carried out, and we found that they had done 2 tests. The 2 of them came positive, right? So there were 2 cases in the whole province, of course. We need to wait almost a month to start to have a measurable number of non-positive tests, so that finally people were truly testing properly, and they were able to find infected individuals and so on. Now, again, the main message here, it's not the model. The main message here is that there's always going to be a problem with the data. So you need to be aware of that. You cannot make your model fit perfectly the data, because then probably it's completely wrong. Now, this is actually what happens in this model. This paper is very famous. I think it was published in Science or something like that. They tried to measure the effectiveness of certain lockdowns all over Europe. And this is what they measured in Spain. I really like this example because you can see there that school closure, according to them, had some effect, a small effect, but there was an effect, right? Now, if you go to the data that they use to get this, it seems that schools in Spain were closed on the 14th of March, right? This is the official data from the European Center for Disease Prevention and Control. Now, the 14th of March was Saturday. Schools are closed on Saturdays, right? They are closed on Saturdays and Sundays. If you measure the effect of closing a school on this Saturday, then you should measure the effect of closing a school every Saturday here. But you don't, because this is completely spurious. This result does not make any sense for the context of Spain. Even more, schools were closed on the 10th, not on the 14th. Point is that each region could decide when to close the schools, and some regions just closed on the 10th, right, way before 14. So there should be, this effect is not social distancing. This effect may be school closing. So again, if you just blindly trust your data and apply it to your model, then the conclusions that you get are probably going to be wrong. Another example is this one. There was this paper that came out that they studied the fatality ratio of kids. How many kids died because of COVID in several European countries, and we have a clear layer, Spain. As you can see, everywhere we have 0.something, 0.something, and in Spain it was 2%. When this paper came out, it was an alarm. Some journalists and some doctors from other countries started to call Spain to the hospitals and what's going on? You have many kids dying. What's the problem in Spain? And the doctors in the hospital said, no, there are no kids dying in hospitals in Spain. I don't know what you got that from. Well, a journalist investigation found out that they were actually people over 100 years old. So the informatic system that they had could only get 2 numbers. In Spain, we have many people that is over 100 years old, and unfortunately, they were very affected by COVID and they died. So when you enter 100-something into the system, the 1 was discarded and you ended up with 2, 3, 4. So it seems that there were many kids dying in Spain, but they were not. They were elderly people. Even more worrisome, well, essentially, this only happened in one of the regions in Spain because the system is completely decentralized. There were like 17 different informatic systems. Only one had the problem. So I would have preferred that the problem was everywhere rather than just being in one place, because in this case, we were able to find out and correct it. But in other problems that are more subtle, if the problem is just in one of the 17, it's going to be much harder to spot it out. Well, actually, when they corrected it, then the numbers were 0.something in line with what we have in Italy. So indeed, there was a problem there, right? It was, again, an informatic problem. Now, Another example of data problems that I like, because I haven't been able to find an answer yet, is this one. These are the number of cases in Catalonia reported by the Spanish ministry, the centralized, let's say, institution that receives data from all the government, all the regions. And this is the Catalan region institution, right? The number of cases, as you can see in both of them, is roughly the same. There are some changes, but I don't know, for whatever reason, I don't care. The point is that if you go to the number of hospitalizations, there is a two-factor between the two time series. I've asked people from the ministry, they didn't know why. I've asked people from the Catalonian government, they didn't know why, and that's it. That's the answer I got. I don't know why. That's it. So which time series should I use for prediction? Actually, this one fits better with the rest of Spain, so probably the one of the regional government is better than the one of the central government, but the central government gets information from the regional government. So, I don't know. Anyway, there are problems everywhere. And I had deleted this. I wanted to skip it, but given that Marco talked about it, I'm going to just briefly mention it. This is RT in Spain, so how we control the epidemic. As you can see, it went below 1 around here, so we are talking slightly before April. But if you go back to the news of those days, you will see that actually, according to the news of those days, it went, it crossed the value of 1 around the first week of April, right? So 1 week after what we see here. And why is that? It's because they were doing this wrong. They realized way after that they were calculating wrongly the value of RT. And the problem was precisely what Marco mentioned. They were using the number of cases that they were detecting rather than taking into account that by the time you detect a case, that case was infected many days before, because there are delays everywhere. There is a delay in detection, there is a delay in reporting, there is a delay until you get symptoms, and so on and so forth. So the Spanish government neglected this, and what was the consequence? The consequence was that they imposed an even more strict lockdown by early April because they thought that they had not reached the value of RT that it was needed. But indeed, if you use the updated data, we see that that was not necessary at all. So whatever economic damage that was done around here was because they were using incorrect data, not because they made a wrong decision. It's because they didn't have the proper data or they did not understand the data that they had. Anyway, let's just wrap this up with this linking of economic modeling and epidemic modeling that was initially the main idea of this talk. So, Marco already presented a model in which we take into account school, household, workplace, and the community layer. So these first models that we used to use had the issue that in the community layer, you assume that everyone's in contact with everyone else, right? This community layer is what has interactions in wherever it's not a school, a household, or a workplace, right? So this could be public transportation, a park, a shop, anywhere. Now, this is problematic. We want to make some claims about certain interventions. So what if someone asks, what happens if, I don't know, we just close stadiums, or we just close gyms, or we need to disentangle this community layer. Fortunately, with some friends in Boston, we got mobility data that allowed us to at least estimate how people move around the city, where do they go, if there should be a lot of people in one place or another, and so on. So with that, with models that were able to disentangle this idea, and I think I have, this is quite boring. This one is better, and it allows us to see where infections are taking place. If we know where infections are taking place, or where we are estimating that they are taking place, then we can say something about what will happen if those places are closed. But again, for this, we need the data. We need to be able to disentangle this community layer. We need to be able to have localized settings and so on. And we need to understand how people move. As a side note, this data was available for the US. This data is completely not available for countries like Spain, because for privacy reasons, they don't give you data around residential areas. Now, in the US, people do not live where they work. But in Spain, everything is cramped up, right? So we just build in height, so the shops are below households. So when we got in contact with some companies, they gave us the data, and essentially we only had data in parks. That's where people don't live, right? That's it. But we could not get any data about where people actually go, which shops they go, if there is a lot of people in gyms, and so on. That's not existent, at least if you respect the privacy of the users of the apps that you use to collect the data. Now, this was the second model that we did. In the previous one, we just aggregated all the time series information. In this one, we had information for each day, and this is the actual real mobility data of individuals in New York and Seattle. So you see that there are around 10, between 8 and 10 contacts every day. You can see a weekly pattern because contacts change on weekends. That's something, again, that depending on what you are trying to answer, you need to take into account. And then when they close the US, then the number of contacts went almost to 0. Right? So it makes sense. Now, with this kind of models, you can say things like this. But again, this is limited because, as Marco said, we don't know how more likely it is that you will get infected in a grocery than in a shop, right? So we know that there is more people in the grocery than in the shop, but that's it. We don't know if it's more likely to get infected in one place or another. So again, this is completely limited because of that. But what I think is interesting is that this depicts a dynamic image of the process. So in here, we are showing the contribution on the number of infections in a setting by super spreading events. So let's say if I go to a certain venue, I'm going to infect just one individual, I'm going to infect 20. So that's what this axis is showing, and this is the total number of infection. What we see is that as time changes, the role of a certain setting, so in this case, it's, I think the colors are, yeah, these are groceries. So groceries, the role of groceries change over time. So whenever they were asking, what's the most important thing that we should close? What's the most important thing that we should do? You always have to say, hey, wait, this is not just pure theory. This is real. Things are changing. People are going to adapt their behavior. So you first need the data to understand it, and then you have to take into account that this is dynamic. If I change a certain type of venue, people may displace to another one. So we need to collect that data, and we need to understand that if we want to provide truly meaningful answers. It's not just a random model that gives me that, oh, we should close this, and that's it. Right? Because things are not static, they are dynamic. And lastly, this tied this with the economy. We got in touch with a group of economists from Oxford. They had a super good economic model to try to understand the economy of the US. This is only valid for the US, again, because they have a very particular working law that may be the same in other countries, I don't know, but at least in Europe it's quite different, because in the US it's much easier to fire someone and they hire that person again. In Spain, for instance, that's completely impossible. During the COVID, people were allowed to go home and then the government paid the salary, but they were still employed by the companies. They were not fired. In the US, they were just fired. It's true that, again, in the US, then they were hired super fast, while in Spain, there was more inertia to get people back into their works. But anyway, what I mean is that, again, you cannot just take this model and apply it to another country blindly, right? So you need to be aware of all the assumptions that are behind these kind of things. And the model is super complex, has many things. I don't want to enter into those details. I just want to mention how we coupled the economy and the epidemic. And we did that through the fear of infection. This is what the economists proposed, that is the thing coupling the economy and the epidemic model. And it's, if people are scared about getting infected, they are not going to consume. If they don't consume, then the businesses are going to be in problem. So they are going to fire people. If they fire people, then people are not going to work, so they're going to get infected in their workplace. So then the disease would go down. And the other way around, if people do not care, they don't have any fear of infection, they are going to keep consuming, so I may have to even hire more people, so more people are going to get infected, and so on. So we have these feedback loops that we try to take into account. And the problem here is that, how do we measure fear of infection? We use this expression that has been proposed that is essentially an exponential with the number of deaths that are reported. This is not even the number of real deaths, it's the reported deaths. It's the idea that, well, it's the number of deaths that the TV tells you that are out there. But any other formulation could be valid. This is something that we don't know. This is something that, even if this is the proper one, let's say, for COVID, in the future, if we have another pandemic, even if it's another variant of COVID pandemic, maybe this expression is no longer valid because we've already experienced a major pandemic recently. So maybe for the next one, we will react in a different way. So this is something that it's going to change, and this is something that it's super hard to measure. But we need to be aware of that, and we need to put the resources, our efforts to try to understand how humans are going to adapt to these kind of situations. And that's it. I only have two conclusions. The first one is that it's truly important to understand the assumptions and limitations of the models, both from the theoretical point of view and also due to the availability of data. And the other one is a quote from a book by Terry Pratchett that I really like, where he's talking about pestilence. And I'll just read this part where it says, pestilence was therefore part human, right? So whenever we study epidemics, we need to be aware that epidemics are partially human, right? We spread the disease to another individual, so we need to take that into account. We cannot just blindly assume that everyone are going to behave in a certain way, or that we are just, I don't know, random particles in a certain cube. No, we are humans, and we need to take into account the human factor in all these things. So I think that's it. Yeah, thank you for your attention.
Questions?
Hi, thank you for your talk. I wanted to ask about the last part where you talked about the model of the fear of infection and hiring and firing people. I wanted to understand better what you found with that. Like, is there an oscillating thing? Because what I thought when you showed that is that you, for example, if not a lot of people are being infected or not a lot of people are dying, then the fear of infection goes down. And then more people start going out, of course. But also if more people start getting infected, maybe they get sick, they have to stay home, so less people start going out, and then fear of infection goes down. How does that work in practice?
That's exactly the idea, and that's going to completely depend on the functional form of the fear of infection. In this particular case, as I said, we are taking into account reported deaths, which means that there is a huge delay between what's happening and the effect that the population is going to produce. And we do not see oscillations. We see that we reach a different stable state, but we always reach a different stable state because there is this lag that prevents you to have these oscillations. It just breaks the periodicity that one should expect. I've seen some papers with other fear of infection functional forms for other models, and they get oscillations. So again, with a different assumption for the fear of infection, the results might be different. And any assumption is, or almost any assumption is valid because we have no idea whatsoever. Fortunately, we were able to calibrate this one a little bit because we had the real mobility data of the population. So we knew if people stopped going to places. Right, disentangle that kind of information was super hard. So what we did was we took the mobility data from the normal period, tried to use that into April, March and April, and we saw that there was a difference between what people in a normal situation were doing and the data that we had. So we assumed that that difference was the fear of infection. So if whatever was needed to make the let's say, normal data be similar to the real data, that was fear of infection. And that's why we were able to calibrate this. And that's why even if we slightly change the functional form, we are going to get similar results because we are calibrating it to data. But if you study this from a theoretical point of view, I can tell you that it's going to change a lot depending on the function that you use. Yeah.
Thank you.
Okay. Over there.
Okay.
Behind? Yeah.
Here.
Hi, congratulations for your presentation. I think that you are very dangerous guy because you are very smart, but when you put together two different disciplinary fields, you incur in a very, very high level of risks. Despite I am, my expertise is in sociology of disaster, I am an economist. We economists, we have 2 centuries of a repertoire of acknowledgement and different paradigms, different theories, and our disciplinary field is very, very dynamic in the context, in the global context of the market, the rules change all of time, etc. You, in your previous ponderations, reflections, you put a very strong critical in terms of the notion of ceteris paribus. But I am critical for this kind of notion. But ceteris paribus is very useful to put in parallel way, né, and separate the main variables, the main relations, the main cycles, the main dynamics that is relevant to deal with one kind of problem, even a complex problem. Né? For example, here you put in exceptional terms né, your connection between epidemiology and economists. And I suppose the 100% of the audience agree with you. But in a real context, when you are exposed, put this kind of exposition, presentation, my colleagues in the University of São Paulo, the main team of the economists there, could not agree with your perspective, because the paradigm there, the dominant paradigm, is the monetarist theory. In the same time, the main group in the economy in the University of Campinas is a new Keynesian team. They both put the nodes, the economic nodes, in terms of the agents, cycles, and even in the structure of power in terms of the finances, etc., to buy foods, etc., in very different conceptions and relation. But you assume in your previous, before your slide of conclusion, in your previous slide before the conclusion, you assume the limitations, you put a phrase, the limitations of the model. Yes, this first phrase. The limitation of the model is exactly what the ceteris paribus are. You have to assume that one kind of dynamic cycle agents, they have less importance than others to respond to a kind of issue that is very relevant for you, is very relevant for the science and for the for the society as well. Thank you for your presence. You are a very brilliant guy.
3 comments. The first one is that the team of economists which we work with, they are kind of outsiders, I know, in the field of economy. They work in complexity economics, and I know that many economists do not like those kind of ideas. Completely aware of that. So those kind of fights, I left them to fight it for me. But no, about the ceteris paribus, my point was not that it cannot be used. It's that when you are using it, you need to be aware that you are using it. You cannot go into public TV and say, when we are in lockdown with, in a world in a completely weird way, and say, if things do not change, everything ends next week. Doesn't make any sense. That's my point. So it's not that you cannot use it. It's that if you do, you need to be aware that you are using it and what are the limitations of that. As, again, as a theoretical physicist, it's pretty common to leave things static and just analyze how other things are changing. That's completely normal. But you need to be aware that those are static. And we are talking about complex systems, the things are even more complex. And the third comment is that we are actually now working with a team of sociologists that, because we want to design some experiments to try to measure the fear of infection. And we've already had 5 or 10 times the fight about how we approach the problem. Because we as a physicist kind of approach it like, let's try to set up the experiment, measure it, and then understand what's going on. While they are, no, we need to set an hypothesis about how things are going to change, what's going to happen, and then we create the experiment to prove if the hypothesis is true or not. And even though I partially agree with that idea, the point is that we don't have any hypothesis. I mean, I can come up with an hypothesis if you want, but I want to see how people behave. I don't have an hypothesis when I go out to the field and throw something and just measure how it falls. I have the hypothesis that it's going to fall, maybe, if you want. But that's not my point. I just want to measure nature. So I think humans are part of nature, so I want to measure them. So these kind of interdisciplinary problems are always in our field because, yeah, we are mixing disciplines, and it's always a problem. Yeah, true.
So thank you very much for your presentation, and I really appreciated it. I want to just make a comment and then a more precise question. So my comment is, I totally acknowledge the contributions of network theory for the study of the spread of epidemic diseases in society and so on. But I wanted to just to hear your opinion, because there are many diseases where contact is not so well defined. So for sexually transmitted diseases, it's pretty much defined, but we don't have data about this. Usually don't have data about this. And for respiratory diseases, it's still like, I don't know, if are we all in contact here or not? That's a problem. And then you have diseases like cholera, which are waterborne and so on. So I don't know how to fit the network theory with these diseases that are where contact is not well defined. So this was my comment. And my more precise question is about your point in your section number 2. At a certain point, you showed us a plot of R of t, which goes down and oscillates and so on. Could you explain me a little bit better how this was calculated and what are the policy implications of your result?
Okay, we did not calculate this. This is the official data from the health ministry in Spain. They were just measuring, essentially, as Marco said, the problem about this metric is that it's very convoluted with what you are doing in the field. So essentially, roughly speaking, it's the number of new infected cases over the number of cases that we had yesterday, let's say. Very, very simplified. No, well, I mean, you need to get the number of cases each day, and then if you want to go with the basic version, you just divide it. But if you want to get it better, you need the generation time. Yeah.
No. It is based on what kind of data?
The number of cases that are detected in the country.
Yeah. How you know this?
Because the hospitals tells you how many people are entering these. They are testing them.
Hospitals only severe case.
But I don't understand.
Now, how do you know the number of new cases every day?
Yeah, you have to test it. You have to test individuals in the population.
You don't test all the population.
But it's proportional. Again, no, I totally agree that it's a problem. I mean, that's why I think that these metrics are sketchy, and you need to be aware of what you're doing. Of course, ideally, to get this perfect, we should be able to test everyone, every day, and then we'll have the perfect number of cases. But since these are proportions, if your surveillance system is constant for a while, the detection that you are getting in a certain day should be proportional to the other day, and then you will get the same curve. But of course, if you increase your surveillance system or you decrease it, or there is a huge outbreak in a specific region, things are going to change. And this metric is going to give you weird results. So you cannot scale it down properly. So yeah, it has its issues.
Yeah, I understand. But on the other point, if you look on testing that is biased to more severe cases, because people that just feel a little bit bad and stay at home, and lots of cases, and therefore they don't get tested because they say okay.
That's precisely
not
why the
important.
results in the early days are super wrong, because there are a lot of biases. But if you have a proper surveillance system, you should also be testing people that are not super sick. You should also be testing in public places. For instance, in the US that was done, sometimes correctly, sometimes incorrectly, but that's more from the public management point of view, the public health policy point of view. It's how you set up a surveillance system that tries to be as less biased as possible. But again, that's more a problem on the field. It's not a problem from the modeling perspective or the theoretical perspective. It's about how you collect the data.
No, I understand it's a problem of the data, but
Yeah.
you are using the data anyhow. Okay.
Well, and about the networks thing, I agree, and I think that's a major issue, and there are a lot of works trying to use network to study these kind of things, and there are major problems there. You cannot, for instance, if you use a static network, you are clearly underestimating many issues. For instance, the susceptible depletion. It seems that you are depleting your susceptible super fast because your neighborhood is constant. But of course, every day you meet new people. Or at least the people in your household is going to be the same, but then the people that you meet in the streets is going to be different. So that at least would require you to use time-varying networks or other kinds of networks. So I totally agree that many of the works that are out there are super theoretical, and that, yeah, you can apply it to real data, but it doesn't really make sense to apply it to real data. And you're going to have to make weird things to force the model to fit the data.
Okay. So let's thank Alberto again.